So what is up with duloxetine, also known as Cymbalta? Duloxetine was first approved for medical use in 2004 in the USA and Europe, and it's in a class of medication called SNRIs, which is selective serotonin norepinephrine reuptake inhibitors. That sounds like a mouthful, but what that means is this medicine blocks the reuptake of serotonin and norepinephrine, whereas things like Zoloft, Prozac, Lexapro only block serotonin. And duloxetine is FDA approved for major depressive disorder, diabetic peripheral neuropathic pain, fibromyalgia, generalized anxiety disorder, and chronic musculoskeletal pain. And as you could see from that approval list, it is not just psychiatric illnesses that Cymbalta duloxetine is useful for. And we know that this one is different than SSRIs because it interacts with norepinephrine. So maybe norepinephrine has something to do with pain. I know you were thinking it because you're very smart. And it does. There is a whole noradrenergic pathway for pain feeling and stimulation in the brain and spinal cord. And maybe there's a video on that for another time. But for the purposes of psychiatric illnesses, a lot of times when people have a major depression, they might get started on an SNRI before they get started on an SSRI. And the reason why is because in head-to-head clinical trials, SSRI versus SNRI for depression, SNRIs tend to do well or do better than SSRIs. But of course, these medications don't come without their side effects. SNRIs like duloxetine and venlafaxine can increase blood pressure. They can cause really increased sweating. They can mess with your sleep-wake cycle, and they can cause sexual dysfunction. Of course, not everybody experiences side effects, and some people experience them very minimally. Everyone is different, so that's why it's important to talk to your doctor about it. Overall, I give duloxetine a B+. I gave Zoloft a B+, but I have my reservations for my A+ medications. Let me know if this was helpful. Let me know if you have any questions.